Good afternoon. I'm Dr. Erik Von Rosenvinge, Chief of Gastroenterology for the VA Maryland Healthcare System and a U.S. Air Force veteran. March is National Colorectal Cancer Awareness Month, and I'm taking this as an opportunity to encourage my fellow veterans to get screened for colorectal cancer, which is a cancer that starts in the colon, also called the large intestine, or in the rectum. Colorectal cancer is one of the most common cancers. In fact, it's the second leading cause of cancer death in the United States. It's estimated that 1 in 22 men and 1 in 24 women in the United States will be diagnosed with colorectal cancer in their lifetime. A statistic I like to point out to my patients who are from the Vietnam War era is that more Americans will die from colorectal cancer this year than were killed in action in the entire Vietnam War. However, we know this doesn't have to be. We know that screening for colorectal cancer is effective, and we know that colorectal cancers that are diagnosed through screening before symptoms develop can be cured about 90% of the time. Unfortunately, about 1 in 3 Americans who are due for colorectal cancer screening are not up to date. So that's why we're encouraging our veteran population to come down and get screened for colorectal cancer. So who should be screened? Well, it's recommended that everyone aged 50 to 75 who are average risk for colon cancer should be screened. We also recommend if you have a family history of colorectal cancer or certain bowel conditions such as inflammatory bowel disease to often start sooner. Some GI societies have recommended for African Americans that they should start screening at age 45. And for veterans or others who are the age 76 to 85, we recommend having a discussion with your providers to see if screening is appropriate for you. So, what are the options for screening? Well, the two most commonly used approaches are a stool-based test called a fecal immunochemical test, or FIT test, and we're encouraging veterans to get fit by coming down and doing a FIT test. Actually, the FIT test you get at the VA, but you do it in the comfort of your home. It's a kit that you take home, and you collect a little sample of your stool, and you mail it into the lab, and the lab tests it for microscopic blood. And if microscopic blood is present, it can be a sign of cancer. So we do, at that point, recommend further testing to look for cancer. The other approach is to do a test called a colonoscopy. We have a picture of a physician doing a colonoscopy here. It's where you have an endoscope or a scope that is a long flexible tube with a light and camera at the end that can be passed gently through the rectum and colon, looking for any cancer or abnormal growth called polyps. If any polyps are present, they can typically be removed right then and there. A colonoscopy does require a bowel clean out, and we do give sedation with the goal of keeping patients safe and comfortable. But because of that sedation, we do require you to bring an escort with you who can drive you home. So there's different pluses and minuses to each of those approaches, and the right test is for you might be different than for someone else, but either way, the right test is the one that gets done. That's the best test. So different options, and which one is right for you, we're happy to discuss and work with you to figure out. But the important thing is to get one of those done. There are other things you can do now to lower your risk for colorectal cancer as well. So getting screened is the most important, but other things can lower your risk as well. So staying physically active and physically fit and trying to stay at your ideal body weight. We also know that diets high in red meat, fat, and processed foods increase the risk for colorectal cancer, so trying to avoid those foods. And diets high in fruits and vegetables and whole grains lower the risk of colorectal cancer, so trying to eat a lot of those. You should avoid smoking, that's linked to colorectal cancer among other cancers as well, and avoid excessive alcohol. But most important, I want to re-emphasize, is getting screened. So if you're due for colorectal cancer screening and you're enrolled in the VA, please call the appointment line, schedule an appointment with your primary, and discuss your screening options. If you're a veteran and not enrolled in the VA, then I would encourage you to go online. You can enroll online, you can call, or you can come down to any of the VA Maryland healthcare facilities and enroll in person. And finally, I'd like to thank you for this opportunity to discuss colorectal cancer screening with you. Encourage you to do it. If you're due, don't delay. Come on down to the VA and get screened today. Thank you.